I'm Sylvia Gordon.
And I'm Rebecca.
We're going to talk a little bit in this video about what?
We're going to talk about how Medicare Advantage sausage is made.
This. You got to have your coffee. You got to have your feet up. You're ready. This is not fun, but it's something everybody asks you. Everybody says, why are plans priced differently in different counties?
Right. How do they do it?
And you need to have a little bit of deep information on how that works. In general, they price it differently because costs are different. But let's just go into it a little bit more.
Okay.
What does the process look like?
The promise of big profit margins are still out there. So the race to capture Med Advantage membership is huge.
So the companies, when they're trying to figure out their plans, they got to get the right mix because they got to make a profit between the benefits that they offer and the providers that they can get in their network and then their marketing. So they got to get that all right. And it changes based on how much money they're getting from the government, based on what's going on with the hospitals in that state, right? So they gotta go back to the drawing board every year to try to get these plans in. And they all are fighting for the low-cost beneficiary.
What is a low-cost beneficiary?
So the beneficiary that they want on a decent plan is easy. The sicker, the better.
Yeah.
They make more money.
And then on an individual plan,
ideally, the healthier, the better.
Healthier one.
They make more money, right?
Kind of a no-brainer on that.
So while enrollment in Medicare Advantage continues to grow, there are areas where it still does not exist.
Yeah, well, when you get to some areas with low enrollments, such as North Dakota, they only have 2% of their population is enrolled in a Medicare Advantage. And also you look at Oregon, it's only 44%. So unlike other states like Florida, Texas, the Carolinas, where that mixture is better and stronger, you're going to have more plans.
Where there's a big population of retirees versus a sparse overall population and low retirees.
You also have to look at these hospital-owned.
Yes.
Hospital-owned plans.
Something you got to take into consideration.
So Minnesota, that's always been a pretty locked down state with their hospital-owned plans, and they won't let other people in.
In a lot of the rural areas, there's one hospital, they have their own Medicare Advantage plan, and they won't let any of the other insurance networks in. Yeah, so that explains some of this penetration. So how much a Medicare Advantage insurance company gets paid in any given county, they start off with how much original Medicare fee-for-service is charged in that county, what their expenses are in that county.
So they're adjusted for geography. They're going to add in risk adjustments for sicker counties and add in quality incentives for the 4-star plans.
So when the company decides what they're going to bid on that, they're going to say, this is how much we want in this county. They have to make that bid. They have to put all this stuff into their pot, and then they send it to CMS, and CMS says yay or nay. Now, when they send these bids, they're based on providing Medicare A and B services to a beneficiary with average health. And that's where the agents come in. Where they brought us in and they're trying to get us to do these risk assessments, RHAs, VBEs. They call it different things, right?
Health assessments, risk assessments.
They want the agents to get involved. And you're like, why does anybody care?
Right.
Why? I have to ask 10 questions.
Well, bids include the estimated cost of medical services, as well as administrative expenses and profits. So they're trying to gauge what their potential risk is.
Right. So they get paid more if you're sick. That's why they want you to do the HRAs, because their bid is based on average. Mm-hmm. But if you're enrolling people that are way sicker, then clearly they're not going to make money. So that's where you come in. So when we go back to the bids, the companies are only allowed to bid 15% profit.
Okay.
So they have to spend 85% on benefits and care.
Mm-hmm.
And if they make more than that, they got to pay back the government. Mm-hmm. So that's interesting. That's the
MLR,
the loss ratio. And a lot of new agents have heard the term MLR, but they don't really know what that means. That means the government has said you cannot make more than this in profit. So I hope you learned something today. I know it was slightly painful, but it will benefit you in your career.
Hope your coffee is still hot. See you, folks.
Bye.